Guys, welcome back to Medical Coding with Blue. Today's episode is all about what to do if you are not learning from your medical billing and coding program. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, so I got this comment from a viewer, and I know I say a lot of times that this comment can resonate with a lot of people on other comments that I've read, but I really feel like this one in particular can resonate with folks because of the simple fact that from what I gather from this comment, this person is feeling a lot of frustration and uncertainty about the future and what to expect and that kind of thing. And so I want to read the comment, and thank you to the viewer who wrote the comment. So here we go. All right. So she says, the teacher in my current class is an adjunct who has never taught a class before in her life. She homeschooled her children and is a coder. She violates college handbook policy and does not allow us to take pictures of her PowerPoints while she races through the lectures. She mispronounces most medical terms. I made a list. She does not know the guidelines. The class is constantly correcting her. She is not teaching us at a level to complete the national exam. She is not accessible for help and does not welcome questions. She gives us major attitude and said she is very frustrated when we ask questions. She cannot explain PowerPoints. Her PowerPoints often give us incorrect information, which we correct her on, which angers her. She has not posted her grades all semester, in my opinion. She has no idea how to grade because she is not an actual college level professor. Our class has struggled and in deep anxiety with this whole matter. This teacher is retaliatory. She makes comments to us to prove this. She is a member of a HEMA, and I intend to write a HEMA because ethics and integrity are supposed to be integral to the field. They are, okay? We are taking our final on Monday, and she is giving us graded practice tests, a practice CPC exam the very next day after the final. The semester has destroyed the experience for our whole class. Some say they won't return. The college seems to be covering up for them. We, our class, some of us have spent upward of $2,000 to purchase supplemental materials to learn because this person cannot teach this course. Why should we be burdened with extra expense? What a nightmare. Our teacher is not a teacher, nor does she know how to teach, nor does she care about our best interests. Her first assignment was about our personal learning style. She's completely disregarded what we wrote. Have not gone over all the body systems. She says we should just figure it out with all that she has not taught. Wish us luck. All right, so here's the deal. Not every person that is in a teaching position should ever be a teacher, okay? It's the same for not every person who's a certified medical coder should actually be a medical coder because as we all know, and as I've said on many shows, some people just do this for the paycheck so that they can collect a check and go home. And somehow they fall through the cracks and they can slide by doing jobs like teaching, okay? And because there's a lot of people, and especially like in the college and academic settings, that if that person doesn't truly understand what we do, that can set the whole program up for failure. Because if you don't understand what we do, how can you expect to know what to expect from your instructors? And even if the person who's at the head of the program has a degree and all that stuff, it does not mean that they understand coding. Because as we all know, and as I've explained before, the degree programs are completely separate from coding. The coding portion of the degree programs is very minimal compared to the rest of it, compared to the rest of the things that they have to learn in the degree program, because the degree holders are not designed to be medical coders. They are designed to be our leaders. So with that out of the way, here's this. There is some good news in all of this, even though this sounds like a hot mess express, y'all. For sure, it sounds like a hot mess express. And I would be very frustrated being in this program as well. Like, I mean, what are we even doing here? As I've mentioned, because I've done this type of video before, what to do when you're not learning from a program, this one thing I did not mention. Even though you're going through a horrible program and they're not teaching you, they're not helping you, and the teacher, doesn't want to listen, it doesn't, want you to ask questions, they get defensive and that kind of thing. That's that situation. Your situation, your goal is to learn. The good news is you can take the national certification exam either with the American Health Information Management Association or the American Academy of Professional Coders. All 4 of the major medical coding certifications out there, the CCS, the gold standard of medical coding credentials, Certified Coding Specialist, the CCA, the Certified Coding Associate, or the Certified Coding Specialist Physician-Based, the CCSP, if with a HEMA, or in AAPC, the CPC, the Certified Professional Coder, none of these 4 requires you to go through a formal program in order to sit for this exam. So even if this person didn't, quote unquote, pass that program, it doesn't mean that they can't sit for the national certification, okay? Now, there may be a thing tied to the school, like the school will pay for it if you pass a program and that kind of thing. And if that's something completely different, but if that's not the case, and sometimes it is, sometimes it isn't, but if it's not the case where they pay for it and you have to pay for it, you can still take the certification exam on your own. You don't have to have anything with the school, okay? The school is there to supposedly teach you. But when they're not teaching you, that's when you have to grab the bull by the horns. I'm a Texan, I say things Texas-like. Grab the bull by the horns and you've got to learn on your own. Does it stink? Yes. That you have to put out more money because this program, which is, I looked online, is about a little under $5,000 for this program. It's a lot of money for not really learning any of these things. But that's the nature of the beast sometimes. Sometimes you get good instructors and sometimes you don't. And when you don't get a good instructor, you have to take the bull by the horns and you have to learn on your own. Take the material that they're giving you. Do not drop the program, but take the material that they are giving you because you paid for that, all right? You didn't pay for their shoddy teaching, but you did pay for those materials. So take the materials like the books and whatever workbooks that they give you, take those and try to learn from them. If you don't understand something, that's when you need to reach out and find a mentor. A mentor is free. A mentor is somebody who's in the industry, who can explain things to you. They do theirs, as a courtesy to you all, okay? Or you can find a tutor. A tutor, you're going to have to pay for, but sometimes that's what you need. You need that one-on-one to be able to bring to this tutor, hey, I have this list of questions. I do tutoring myself. My rate is in the description box below and my contact information. When I tutor people, I expect them to come to me with a list of questions that they are confused about, whether it is how to code a particular procedure or they don't understand how to look up codes. I need to know something so that I know specifically how to help you. And that's what a tutor is designed for, not to teach you a whole program, okay? Some of us are not set up that way. I certainly am not set up as a whole program from A to Z, okay? I do my best with tutoring, and I also do my best with my Patreon channel. Patreon is where I post all of my exercises, my coding exercises and scenarios, puzzles to help you with medical terminology and anatomy and that kind of thing. And I do that for my Patreons because when I tried to do it here, there was a lot of people that were being ungrateful for the efforts that I make to help you all to learn. So I was like, no, I'm going to give it to people who are there to support me in my own educational efforts. And so I'm there to support them. So it's it's a very give and take relationship on Patreon. And I'm very thankful to all of my Patreons because they are certainly helping me to further my education as I am trying to help them with theirs. So if you're interested in Patreon, that link is below. But going on, you can teach yourself. I've done a series last week on how to study the guidelines, how to study CPT. This week, if I don't post it Monday, I'm going to post it certainly on Tuesday because I don't know. I'm batch filming today, guys. So I will be going over how to study the ICD-10 CM book and also how to study the ICD-10 PCS book. Now, I will say this also as an aside. On the PCS video, it's going to be a book from 2021, but that's okay. Structurally, the ICD-10 PCS book is the same, so you can follow along even if you have a 2023 edition of that PCS book. But the way that I explain how to study hopefully will be a supplement to, you know, what you're learning in this type of program if you're not learning from the teacher. And a lot of times what happens is the students will like get into groups and like sort of commiserate on what's going on and, oh, I don't understand. And then all of a sudden it's a runaway train. You have to be very careful about that, because people in this type of situation, yes, they're going to get together and complain, oh, the teacher's not teaching us and I'm so pissed off and mad, and it's understandable. But don't let that be the focus of your groups. If you are going to do a study group, don't let that be the focus of your study group. All right, let it be, okay, we have a common issue here with this teacher that's not teaching us, so let's go ahead and work on this together. Let's teach each other. What do you know that I don't understand? Because that's the best way to retain information, is by teaching it back to somebody else. And I ran into this problem when I was in school. I went to a trade school that is no longer there. They sat me in front of a computer and told me, here, learn. And I had to go through all these self-directed modules. We had an instructor that would come in once every week or every 2 weeks or so, and he would do live lectures. This guy was a creep. No, I was not going to his classes because he was too creepy for me. I mean, ew, you know. So that took all of that out of the way. And he didn't really teach either. He would just go over a few things, and then he would tell us about how we would learn out in the real world and how they would teach us. No. When you get into the real world, your employer will expect you to know what you're doing, as far as at least the basics of how to look up codes, how to look up procedures, how to level E&M, how to apply modifiers. They are going to want you to know that. If you don't know that, that's a thing that you need to put on your list of things that you know. I have recommended before, make a list with 2 columns, things that you know and things that you don't know. So that way you could start plucking off this list of things that you don't know, so that you could put them on the things that you do know. And if you are in a study group, this is what you all can do together. Write down the things that you understand and know, and write down the things that you don't understand, okay? And then find somebody in the group. Hey, do you understand this? Oh, you do? Okay, how do you do this? And so it gives them a chance to explain. And then by the time you know it, you're all learning from each other. And you're not going to need that silly old teacher that doesn't know or doesn't like to teach or gets very frustrated and mad. You're not going to need that, because you have each other. Medical coding is something that you can learn on your own. It just takes discipline, guys. I know that for a lot of my viewers, some viewers that have written me, they have followed my independent study video, which is in the description box below. It has the whole syllabus of what you need to study, what books you need, and these are not expensive books. I've looked for the cheapest books that I can find that are quality books. Somebody still complained that, oh, those books are so expensive. You're not going to learn this for free, guys. You're not. Medical coding is not for free. You will not learn it for free. You have to put investment of book money and your time. Those are 2 things that are going to be required in order for you to learn, okay? But I do my best to try to find the best quality books for you all to learn from. Now, some of the books that I recommended, the CPC study guide, which will help you with CPT, even if you are taking an AHIMA exam, because I always get that. Well, Bleu, you recommended the CPC study guide. I'm not taking the CPC. You don't have to take the CPC, because that study guide covers CPT. We are all tested on the same manual. It's just AAPC wrote that book. And I say that AAPC did a fantastic job. Now, I will give it to them. I'm not with them. This is not an ad for them. They do not pay me, okay? But I do this because I want to support you all, and so that you all know which book I recommend. And the American Hospital Association, ICD-10-CM and ICD-10-PCS, that's going to cover all of your diagnosis coding and all of your inpatient procedures. Now, if you are not taking an exam that has PCS on it, meaning that you are taking either the CCSP or the CPC, you can skip over that PCS portion and just stick with the diagnosis portion. So that way you can learn from that book. That American Hospital Association book is excellent. And that's the main book that you need to be able to learn those things. And it has scenarios in the back with the answers, much like the CPC study guide, which will also give you the answers. So if you are not learning from your teacher, these books can help you because they have the answers. You can reverse teach yourself, which is a method that I used when I was learning PCS. I have never worked on the inpatient side before as far as working with PCS. I've done professional feed coding, but I have not done inpatient procedures. And so before I sat for my CCS, I took 6 months to study so that way I could prepare myself. And I worked through the ICD-10 PCS Optum book. Now I'll be showing y'all that later this week on how I did that, how I studied with that. I also used the American Hospital Association ICD-10-CM and ICD-10 PCS coding handbook with the answers to help me to study for that PCS side. Again, this is something that you all can do. This is going to take back your control of learning, okay? Because right now it feels like it's out of control, right, with this teacher. She's not teaching you all the body sections. So you know that if the teacher is not teaching you the body sections, you know you have to go back and do that. You have to find materials where you can learn about anatomy and medical terminology. And trust me, with all the videos that are on YouTube about anatomy and medical terminology, there is zero excuse for not learning it on your own. You can, guys. And you might feel resentment that you spent all this money and now you still have to learn on your own. And unfortunately, guys, that's the reality of the situation. There's going to be times like this where the school didn't teach you. That's why I do the best that I can to give you all the resources out there. And I leave them in the description box, guys, because no one is going to hand feed you this information. It can be there. It can be available to you so that you can look for it, research it, find it. Because that's the only way you're going to be able to make a success out of yourself by doing that, okay? And that's something that's going to take a lot of energy and, again, a lot of discipline for you to do. But don't let a situation like this with a teacher like that, because I know that they're not the only ones dealing with a teacher like that. I know there's a lot of them. They rush through slides. They mispronounce words. I see medical terminology words mispronounced all the time, unfortunately. Now, yes, there are some times where some people have a little bit of an accent, things like that, but there's really no excuse for blatantly mispronouncing medical terms, okay? I struggled with hierarchical, that word, when we were talking about hierarchical condition category coding for a long time. I struggled with it, but now I finally got it down, right? But there's a lot of words that are mispronounced, and again, there's no reason for it when there's a whole internet of Google out there that can help you to pronounce words that maybe you don't understand how to pronounce, okay? And yes, sometimes you may not know that you're mispronouncing it, as I have had the experience of. I used to say olecranon for olecranon. I didn't know that's how it's spelled, so it's just like, whatever, So, I mean, but you learn, okay? But there is a saying that those who can't do, teach, okay? And so sometimes that's the case with some of these instructors, all right? By going through school that you had some instructors who were great. You had some instructors who were not so great. And what did you do with the instructors that were not so great? You looked for other resources to help you learn. It does not mean that you cannot sit for the national certification exam, even if you fail these programs, okay, guys? You can fail that program, but if you're studying on your own and you find out that you are just as good to be able to sit for the exam, you're prepared and you're ready. You've taken the 90 days after your program in order to prepare yourself like you should. And then you're able to take your certification exam, and guess what? You pass. But the onus is on who? You, right? The onus is on you to be able to do that, to take control, to take back those reins, and not feel sorry for yourself, or not feel like, oh, this happened to me and now I have no other choice because I'm stuck with this crummy teacher. No, you take the bull by the horns. You get with these books. You watch my videos when I'm telling you guys how to study for CPT, ICD-10-CM, and ICD-10-PCS. Again, the CM and the PCS are coming up this week. But last week I did how to study the guidelines, how to study CPT, and reviewing the books. Those are all there, guys. You can go to my YouTube homepage for Medical Coding with Blue, and you'll be able to see all of the videos in chronological order, and you'll be able to see where I've said how to study. All right. And take my advice, because these are the things that I used to help me when I was studying for these exams. And guys, I've taken 3 successfully with AHIMA, and I've passed all of them. Okay. The CCA, the CCSP, and the CCS. I currently only carry the CCSP and the CCS because AHIMA will dissolve the CCA when you get what they consider the next level credential, which is the CCSP or the CCS. And because I got the CCSP first and not the CCS, that's why I will continue to carry both of them, okay? But I certainly could drop the CCSP if I wanted, okay? But because I earned them both, I'm going to keep them both, all right? But that's just my advice, guys. You can take the bull by the horns and you can study on your own. There's plenty of workbooks out there. Again, the workbooks that I recommend are in the description box below. Do not let a bad experience like this stop you. Do not drop that program because you've paid for it. Get the material and don't worry about what that teacher says. You worry about finding your way with these books. If you are in a study group, make sure that y'all stay focused. Make those lists of what I know and what I don't know. And then y'all compare. And whatever somebody knows that you don't know, then y'all can start working that way. And that's a perfect way to do a study group, okay? People have asked me before if I do study group sessions, if, you know, they do that. I do that. I've never done it with a group before, but if you're interested in that, just contact me and let me know, and we'll work it out. All right. But again, all of my rates are in the description box below if you want to reach out for any of my services. So I'm going to go ahead and wrap this one up, but thank you guys so much for joining me. If this is going on with you, again, stay in the fight. Don't give up just because you have a horrible teacher. Okay, guys, there's so much to learn out there, and there's so many great resources on YouTube as far as medical terminology and anatomy videos. Get with those, okay? Again, I have my Patreon channel that has all of the exercises on it too. So with that said, I'm gonna wrap this one up. Thank you guys so much for joining me. Best of luck to you out there. Again, I will see y'all next time. Bye.